from the break. In our next agenda item, we will be hearing from two speakers. Our first presenter is Susan Hurley. She is currently a research scientist in the Exposure Surveillance and Epidemiology Unit at CDPH, and was previously a research scientist in SABS at OEHA. She will be presenting results from the Stockton Air Pollution Exposure Project.
Thank you, Meg. Can you guys hear me okay? Should I move this? Oh, it's taped now. Okay, good. Okay, thank you. So I just wanted to start by showing again the main objectives of the study. Stephanie showed this earlier, but we had two primary objectives. One is to learn more about air pollution exposures to school children in Stockton, and then to evaluate the effectiveness of air filtration at reducing those exposures. So last March, I presented some preliminary findings pertaining to this first objective here, which is to learn more about air pollution exposures. And today I will be presenting some follow-up to those findings and then sharing our results pertaining to the effectiveness of the school air filtration. So this is just a brief overview of our study design. You've all seen this before, but we conducted the study in one small school in Stockton, where we measured air pollutant levels inside and outside of the school. And we installed portable air cleaners in about half the classrooms of participating students. And then we had parents complete online questionnaires about demographics and some exposures. And then we collected children's urine before and after school, and then measured chemicals in that urine that could indicate exposure to air pollution. So the study was, our goal was to enroll 50 children. Our actual enrollment was 18 kids. We collected a total of 69 valid urine samples on 2 days of consecutive weeks in early December 2021. So we had 1 sample before school, 1 sample after school on each child for each day of the study. And so back in March, I reported on the levels of the urinary metabolites of VOCs and PAHs, and then compared them to those reported in the most recent available data from NHANES. And so this is just a quick reiteration of those findings. So we found evidence of nearly universal exposure to fluorine, naphthalene, phenanthrene, pyrene, acrolein, acrylonitrile, crotonaldehyde, and propylene oxide. Exposures to benzene and 1,3-butadiene were comparatively less common. And then, except for naphthalene, the metabolite levels for the other PAHs and the VOCs were comparable to or lower than what we saw in kids participating in NHANES. So, but for naphthalene, the median level of 2-naphthol, which is a metabolite of naphthalene, was nearly 4 times as high in SAPEP as what we saw in NHANES. So while this study is a super small study, it's not meant to be representative of the population in general, just given how high the levels seem to be, we figured that warranted further investigation. So sort of our first step was just to figure out, well, are these exposures truly high, or could our 2-naphthol results be an artifact of laboratory methods or some other kind of measurement issues? And then if they are high, then why? What chemicals are they being exposed to, and how are they being exposed? So that was kind of our strategy setting out on this. And to answer the first question about lab methods, there are some important differences. NHANES uses GCMS, and they report their results separately for 2-naphthol and 1-naphthol. Those are both metabolites of naphthalene. Our UCSF lab colleagues used LCMS, and they reported their results for 2-naphthol, but indicated that there was probably some coelution of 1-naphthol. And so what we did was we went back to the NHANES data, and we grabbed the 1-naphthol levels, added them. I'm sorry, this pointer's really funky. Added them to the 2-naphthol, and then compared our results again. And you can see, if you compare this middle bar, this is where the NHANES concludes 1 and 2-naphthol compared to ours, and our levels still seem to be considerably higher. Okay, so then the other important difference between SAPEP and NHANES is the sampling time. So the most recent data on kids on 2-naphthol in NHANES was collected about 5 years before our samples were collected. And that's important because we have seen some US biomonitoring data that suggests a recent upward trend in 2-naphthol levels, especially in kids. So it might be that the apparent higher levels we're seeing in our study might just be explained by this underlying trend in the general population. And so it might not indicate that there's some kind of special exposure to our population, but it's just that something's going on in the general population. Then the other time consideration is SAPEP samples were collected in the winter when naphthalene air concentrations are typically high, especially in this area. And NHANES is collected, they collect their samples year round. So our apparent higher levels could just be partially explained by these seasonal differences in sampling. So given the limitations in comparing our data to NHANES, we did try to look to other sources of data, other studies, just to see how our levels compare. Unfortunately, there's not a lot of contemporary data on 2-naphthol in kids, but from what we could find, it did look like our levels are higher than what is being reported in other studies. And then it's also noteworthy to mention that Peyton Jacobs' lab at UCSF, which did our laboratory analyses, also did some analyses on this other study of these adults in Midwest who use tobacco and other kind of smoking things. And so they used the same methods, and the samples were collected about the same time. And our levels are about twice as high as what he found in those other samples. So the bottom line is we think, yeah, these levels do look like they're unusually high. And so then our next step is has been to try to figure out why. And so this is just kind of a roadmap for the steps that we've been taking to try to figure out what's going on. And it involves kind of a number of things. One is looking more closely at the air and questionnaire data to identify factors that are associated with the high 2-naphthol levels. We also, the UCSF lab is going to be doing some follow-up, or is doing some follow-up lab analysis, which will help us separate out 1-naphthol from 2-naphthol. I'll say a little bit more about that in a little bit. And then we've also been looking at environmental monitoring data to see if there's any data out there that might help us discern potential exposure sources in the community. So we're kind of working on all these things all at once because we really are eager to get a better understanding of how to interpret our results so we can get the findings back to the community and be able to talk about the best way to interpret them. But so what we know from what we've looked at so far, from the data we have in hand, based on the questionnaire data, the only significant predictor of 2-naphthol was living in a home with an attached garage. And that is consistent with other exposure studies and likely just reflects exhaust and evaporative emissions from the vehicles that are parked in the garage. We also did see a marginally significant increased levels in with kids who had recently consumed fried, grilled, barbecued, smoked, or roasted food. We don't think our high levels are being driven by tobacco exposures. There was very little self-reported tobacco exposures in the study, and they weren't associated with the level, the 2-naphthol in the urine. And we also didn't see any kind of correlation between nicotine metabolites in the urine and 2-naphthol in the urine. And then at the suggestion of someone on the panel last time, who suggested we look at agricultural burning as a source, we did look at data on that, and it doesn't look like that's a likely explanation. There was no burning in the Stockton area during the first week of the study when our naphthalene air levels were actually at their highest. So we're continuing to sort of pursue all of these, particularly the last one, which is looking at trying to figure out potential local exposure sources. But those efforts are really going to be sort of driven or informed by what we find in our follow-up lab analyses. So I wanted to say a little bit more about that. So the main purpose of these analyses is to separate one naphthol from two naphthol as a way to help identify the potential parent compounds of exposure of concern. So naphthalene is metabolized, try to use this pointer, to both one naphthol and two naphthol. So 2-naphthol in the urine can also come from direct exposures to 2-naphthol, which is an industrial chemical. It's used in a variety of manufacturing. But outside of occupational settings, it's not really thought to be a main driver of exposures in the community. 2-naphthol is just generally regarded as a pretty specific good biomarker for naphthalene exposures. 1-naphthol, on the other hand, is not as specific. It can be, it can come from metabolism of other chemical exposures, and carbaryl, which is pesticide, is the one that's probably most important. There have been multiple reports of people with super high levels of 1-naphthol who have known exposures to carbaryl. So our findings from the lab, we're very eager to see them because it will really help us figure out what's going on here. And we will share those when we get them. But moving on, so that's all I'm going to say about the naphthalene results for today. And now I want to, the second half of my talk is on evaluating the effectiveness of the school air filtration. And so some of that, we showed a little bit of this before. Oh, well, let me start with this. So you know, there's a lot on this slide. This is just sort of a summary of where all the kids were in the classrooms and where we had the portable air cleaners and where we had the air monitoring data. But the main thing I want to call your attention to is we have 18 participants, each one of these little people. And there's 10 who have the air quality data. So that's the PAHs, black carbon, PM 2.5. Half of them have a portable air cleaner in their classrooms, the other half don't. And then we have these 8 participants in classrooms 5 and 6 through 8 who we only have the urine data. So this is for week 1. And then week 2, we added the VOCs. We also added portable air cleaners to 2 of the classrooms. And unfortunately, we lost 2 participants. So this shows the physical layout of the school, along with which classrooms have the portable air cleaners. And I show this mainly just so you can kind of get a lay of the land. You can see it's a very small school. There's only a few classrooms, but it is kind of spread out. The playground is down here. I can't, here it is, here. And that's, and then the road right next to the playground, that's where the kids get dropped off and picked up. So there's a lot of idling cars in the morning and after school. And then the other thing is the classrooms are kind of spread out. So these classrooms in the front, these are all permanent structures. The ones in the back are portables. And so there's really a mix of structures with differing HVAC systems and differing ventilation characteristics. Okay, so on to our results. So this is the our analysis, a summary of our analysis of the effect of the portable air cleaners on air concentrations. And what you can see for both PM 2.5 and black carbon, we see the highest levels are outdoors. These boxes, I'll just say it by color. I'm going to stop pointing. The boxes in gray. And then in the middle, those brick colored brown, that's the classrooms without portable air cleaners. And we see that it goes from highest outdoors to the classrooms with no portable air cleaners, and the lowest levels were in the classrooms with portable air cleaners. Now, this is an auxiliary analysis that was led by Jeff Wagner's group at CDPH. This is the same kind of thing that I believe is being done in Fresca. And this is to try to get at sources by looking at the types of particles that are found. So 2 passive samplers were deployed in, well, two classrooms and one in an outdoor location, and then they were analyzed by scanning electron microscopy. And what they found is that sodium salt fog particles and aluminum silicate dust were the most abundant types of particles found in the sampling at the school. And, this is the first time I think Jeff's deployed these for such a short period of time. And so we weren't sure it was going to work, but it actually looks like it worked quite well. So we think this could be a useful tool in future community biomonitoring studies. Okay, so on to the PAHs. So these are based on 24-hour samples collected on each day of the study, two outdoor locations, and then 2 classrooms with portable air cleaners and 2 without. We measured 17 different PAHs, including those in the particulate and vapor phase. And unfortunately, week 2 levels were very low due to a massive rainstorm. And so we really couldn't do formal statistical analysis due to small numbers. But for each of the 17 PAHs, we sort of just constructed these plots like I've shown here. This is just one example. Naphthalene, where we just took the average of day 1 and day 2 and just visually created a figure so we could kind of see what's going on. And so for all the classrooms, for most of the PAHs, they all kind of have the same pattern, where the highest level is seen in the classrooms without a portable air cleaner. And then the portable air cleaners are usually the lowest. And then for the VOC analyses, these were based on 8-hour samples collected on each day at 1 outdoor location, then 2 classrooms with and without the portable air cleaners. These were only done during week 2 because we only had the funds to do it during 1 week, and unfortunately we picked the week that it rained. So we had detectable levels reported for 8 of the 68 VOC analytes that we measured. And here, these are the 8. And you can see the patterns are kind of similar, where we see the lowest levels in the classrooms with the portable air cleaners. So then on to our biomarker analyses. So for these, we ran just pretty simple regression models where we logged, we regressed the PM metabolite level, so what was measured after school, on what they came to school with, so the AM level, and then put an indicator variable in there for whether or not they were in a classroom with a portable air cleaner or not. And so this is just a summary where the pack effect is just derived from the beta coefficients for the portable air cleaners. And all of these, the negative percentages indicate that, or suggest that the portable air cleaners, the levels went down more in kids who were in a classroom with a portable air cleaner than not. But as you can see, none of them were statistically significant, but the pattern is consistent with a positive effect. Using the same approach, though, for the VOC metabolites, here we really did not see any consistent evidence for an effect of the portable air cleaners. The regression coefficients go in both directions, and the p-values are very high. So our overall summary is that the use of portable air cleaners modestly reduced the concentration of PM2.5 and black carbon in the classroom air. It may have also reduced the concentration for some of the PAHs and VOCs, but we can't say for certain. And then the degree to which these reductions in air concentrations reduce children's overall exposure, so based on the biomonitoring data, is really difficult to ascertain just due to study limitations. And really, the overarching limitation of our study is lack of statistical power. When we designed the study, our power calculations were based on a sample size of 50 kids and a reduction in air pollutants of at least 50%, and we didn't meet either of those expectations. We also, the air pollution in Stockton at the time we conducted the study was actually not that bad. So we didn't have, super high levels. And then, as I mentioned earlier, the classrooms really had there was a lot of variability in their HVAC systems and the ventilation conditions. So it was just very noisy data. And so it's hard to really pick up a signal for the portable air cleaners. And then on top of that, we were doing this during a pandemic. And so there were certain factors that may have modified exposure that we just didn't have any control over. So the doors were left open, all the kids were wearing masks. But despite those limitations, we do think that we did get some things of value from this study. We really were able to refine our methods and tools for doing these kinds of studies. We could apply it in the future. The kits that we had for the do-it-yourself urine sample collection, but the kids actually, they did a really nice, good job. Also, for the first time as a program, we were able to return individual results to the participants electronically. So that's I think going to make things a lot easier in the future, and then also open maybe some new strategies for communicating those findings. And then, the participants did get information about their exposures and tips for how they can reduce them. And we did leave the school with portable air cleaners, and the purple air monitors are still up and running. So they're providing important information about hyperlocal exposures in Stockton, where at least as of when we started the study, there were almost no purple air monitors there. And so I guess, while there's not a lot of definitive conclusions we can make from SAPEP alone, we're hoping that when we get the data from Biosphere, we will learn more about these kinds of exposures to kids, and we also will get some insights into the utility of these biomarkers and understanding those exposures. So with that, I am done. And I just want to give a shout out to McKenna Thompson and Dan Sultana, who did most of the data analyses and really helped put a lot of these slides together. So with that, I can take questions.
We have 5 minutes for questions from the panel and from the audience or online attendees. I have one question. When you mentioned that all of the students wore masks, I did a super quick Google about what volatiles are released from masks, and we don't know what kind of masks they were wearing, but
we actually do know what kind. Well, we don't know exactly what kind, but yes, we came across that as well.
What did you conclude from that?
Well, so half of our students wore cloth masks and half wore the disposable surgical masks. And we didn't see any differences between the two, but yeah.
That's helpful. Other questions? Jenny.
Hi, this is just a clarifying question. So for your biomonitoring data, you had morning and afternoon samples over each week, right?
Yes.
So you had multiple samples per kid, or is it?
We mostly had 4 samples per kid.
Okay.
So the plan was we would have one day in week 1 before and after, and one day the same day of the week 2 before and after. So you'd have 4 for each, but there was a little, things slipped a little.
So when you did the analysis of biomarker reduction, was that in the absolute, you just combining all the morning and afternoon samples, or is it difference between morning and afternoon? I'm just thinking of the half-life of the compounds that you're measuring.
Yeah, it was a difference in the morning to after. So we ran those regressions where the outcome was the afternoon, and then it was regressed on the morning, and then an IQ, and then we had an indicator for IQ air. And so we used the beta coefficient for the indicator for IQ air to see were there differences in the changes between morning and afternoon in kids with and without classrooms with IQ air.
So just remember the half-lives. I know for benzene is super short. Maybe I should ask you about pHs over here. But interested in the half-life.
Yeah.
Okay.
So that was why we thought we would be able to see something. Yeah.
All right. Thank you.
Oh yeah. And then Tom, did you have a question? We can go right around.
So my question, you mentioned 2-naphthalene as being like barbecue foods was a source of exposure.
Well-
but 1-naphthalene, it's not.
Well,
One naphthol, sorry,
yeah,
yeah.
1-naphthol is not.
Yeah.
At least that's my understanding from my reading of the literature. And then even for 2-naphthol, you don't often see eating as being associated with that, but some of the studies of like in Guatemala, where they look at cook stoves and those kinds of exposures, the cooking does seem to be related to 2-naphthol in the urine. Now, we did ask about cooking, but, it's very sort of crude indicator variable. So, it could actually more reflect exposures from the cooking.
I don't usually think of those with, I don't associate those with barbecue so much.
Yeah. Yeah.
In your analysis of the major PM types, the major component was sodium salt from fog.
Yeah.
Is there fog penetration into Stockton during this time from coastal? I mean, I would expect sea salt
Yeah.
fog particles to be of ocean origin or bay or something.
Yeah. Well, and I might let Jeff Wagner, if he's on the line, jump in on this, but I think hypothesized sources are that fog coming in actually from the that might be laden with sulfur from refinery emissions in Contra Costa County, that may be carrying some of that in. And then also at the Port of Stockton, there is typically storage of sulfur pilings, or that is a byproduct of refineries that's stored in the port and then transported out from there. So that's another possibility. But Jeff, if you want to say any more about that.
Yeah, hi, this is Jeff Wagner, Chief of the CDPH Environmental Health Lab. Yeah, Susan, I think you pretty much covered it. I would just add that, yeah, we're not really sure. We know it was humid and rainy during the study period. So certainly some type of water in there makes sense, but there's historically radiation fogs that originate in the valley, as well as the possibility of fogs drifting in from the San Francisco Bay Area. Past all these refineries we know, as well as the local piles of sulfur that Susan mentioned.
Just a quick follow-up. They store, I seem to recall going through the area, there's sulfur piles too, right? Somewhere around this area where they,
Yeah, I think that's
they
what,
ship bulk sulfur out of somewhere around here.
yeah, out of the Port of Stockton, yes. And the school is about 3 miles south of the port, so east.
Thank you so much, Susan. We appreciate the presentation. And we'll move along to our next presenter. I want to introduce Nina Holland, who is professor in the Environmental Health Sciences Division of UC Berkeley School of Public Health. She is also the director of the BPH Biorepository and the Children's Environmental Health Laboratory. Her background is in genetics, with extensive experience in molecular epidemiology, cytogenetics, and epigenetics. Her lab is involved in several ongoing projects, including Chamacos and CHAPS cohorts, as well as the Stockton Air Pollution Exposure Project. And today she'll be presenting on the results of the biomarkers response data collected from SAPEP.
It's a pleasure to be here. Thank you. Good afternoon. Nice to see people online, not just on the screen. So this was a small study. Thank you, Susan. She described strengths and limitations of this study, some lack of having low exposure. Unfortunately, it turned out to be somewhat disadvantage to the addressing the goals of this exposure project. So it was a lot of collaborators involved. And my contribution, my lab contribution, was to look at the biomarkers of response, biomarkers of effect, otherwise known in molecular epidemiology. And not preaching to convert it, but we all used to look at the effects of air pollution exposure from data that come from ambient air pollution monitoring system. We look at markers that measured indoor, outdoors, and also we really want to understand how all this exposure end up potentially harming internal system of the organism, children especially, because they're particularly susceptible, vulnerable due to metabolic things, rate of inhalation. So advantage of using some of the urinary biomarkers is that we are able to get kind of a general assessment and then establish relationship between different markers of exposure on different levels, and then potentially see, okay, what could be this early response changes that in turn we can link then with certain health outcomes. So it's a very noble goal. This study made a very small, humble contribution to this data using this collection that took place in Stockton. And as Susan already mentioned, there was only 18 school children that we got samples from. They were repeated measurements, so we got actually 67 urines that we received to analyze the biomarkers. And before the study, we kind of thought about what biomarkers can give us potentially somewhat complementary information. So we chosen 2 biomarkers of primarily oxidative stress and other biomarkers of inflammation and all lung injury. So we analysis, we adjusted for specific gravity, we focused on that, but we also did creatinine adjustment. Everything was log transformed for future analysis. And some of the analysis was done by Daniel, who is not here, but some of that done by people in my lab. So given the limitations of the numbers, what we decided to do to kind of assess what potentially causes variability we can figure out, because there is not much data in children. So when we looked at these study participants in this one, 13 were boys, 5 girls between 5 and 13 years of age. And 61% were Hispanic. So what was noticeable to us when we looked at this relationship between BMI and age? So it's quite obvious that there is a strong increase in BMI with age. And unfortunately, quite a few of these children are overweight and obese. And people who are collecting samples also told me that especially boys tend to be quite large for their age. However, when we compared with enhanced data, it's very consistent that even this small group of children in Stockton was within the range that is presented for the same age group in enhanced. So even we are not happy with this consistent increase in BMI, it's a reality that we all are facing. And I've done quite a bit of studies on causes of obesity, so I'm not particularly surprised to see it in this study. So a few words about these biomarkers that we measured. Isoprostanes are well-known biomarkers of oxidative stress. There are a bunch of studies. We've done some of the studies going back to 92, 2000, and recently we published a paper based on CHAPS cohort. This is cohorts of children in Fresno County, in Fresno city, one of the most polluted, using the same assay that we later employed for this particular study. There are studies internationally, so it's well-established biomarkers. So we felt pretty confident, and it's biomarker of lipid peroxidation. In contrast, adesoxyguanosine assesses oxidative damage to DNA and other nucleic acids. So it was interesting to us to see what we will find in relationship to this air pollution in these children in Stockton. There are some other references available, but not much in children actually, mostly adults. Okay, let's go back. So this is the prostaglandins. We looked at prostaglandins, PGE2, very abundant in body in different fluids related to inflammation, immune response. So some were associated with impaired air function in children with severe asthma and demonstrated increased in former smokers, but this is adults with COPD. CC16 is another marker that kind of gives us more insight in the effect on lung injury. So because when epithelium is injured, there is this leaking in the bloodstream and ends up essentially in urine where we can measure. We've also done several of these studies over the years in children and adults, including CHAPS children that I mentioned earlier. It's a Fresno cohort that was published last year. So we done several analyses before we engaged in this project because we wanted to find the most reliable with reproducibility because we want to have a high throughput. So it's a monosorbent assay. Many of you probably done ELISA or no, so I'm not going to go into too much detail. Just to mention that for each of them, we use 96 well plate, everything done in duplicate, and we do calibration curve. And then based on the calibration curve, we calculate the levels in individual subjects for each of these biomarkers. So each biomarker has to be done in the separate assay. So essentially for each of these subjects, we've done 4 assays, 4 experiments. And on the plate, we usually are able to estimate 32 subjects per plate, but we've done multiple repeats, especially for situations when we had some data that we wanted to make sure that we measured correctly. So this is a kind of descriptive information on distribution of these biomarkers of response. We see 4 different lines of this data, and pretty much everything we were able to measure. One subject had very low level of C16, but the rest of it was measurable, and we have distributions that we try to compare what we knew based on our previous study. For instance, in CHAPS children, our level here in Stockton was slightly lower, not that significantly lower, but slightly lower, 5.5 with Stockton, and here we have essentially 4.55 by geometric, comparable. We have a little higher level than CHAPS for CC16. We were somewhat surprised by that, but again, given that we have so relatively few subjects, there is always inter-individual variability, and that was interesting to us to kind of explore what are the causes. Because many of these biomarkers not only respond to air pollution, but they may depend on diet, they may depend on other exposures that children may have. So we looked at the distribution, and it was for each child, we had between 2 and 4. This just shows for 2 biomarkers, but the same story we see for all 4 of them. So we can see that while some of them may have a relatively tight vertical distribution, for instance, the very first subject on isoprostane chart is very, very tight. And these measurements are across 2 weeks, morning and evening, and 2 weeks repeated. We did not attempt to look very closely why and how to compare week 1, week 2, morning and evening. I have to confess, we did look at it a little bit, but the only difference we observed that probably is not very statistically reliable, that week 2 was slightly lower for some of the children in general than week 1. But we are not standing by this data because it's just not a strong enough study design and especially number of subjects. So I just want to emphasize that there is this typical variability, intra-subject variability, inter-individual, and inter-individual variability. So what is behind this variability that we can possibly see? Okay, this is what we found, that there is actually a very interesting relationship between these different biomarkers, looking at the different potential mechanisms. So we see a highly significant correlation between prostaglandin and isoprostane, and also this desoxyguanidine. CC16 has statistically significant or close to statistically significant relationship with 3 other biomarkers. Okay, so they at least point in the same direction. So it is already good to know. So this is a little more detail on response in relation to age and BMI. So red is BMI of children and age is blue. So for isoprostane, we do see somewhat, statistically significant, even not very high, but statistically significant correlation with both, especially with BMI and somewhat borderline with age. CC16, some of them values that are very low, remember they are log transformed, this is the negative portion of it, but the answer is the same, highly significant relationship increasing of these biomarkers with age and BMI. The same with PG, with prostaglandin. So surprising somewhat to me was that desoxyguanidine actually negatively correlated with age, but not with BMI. So it was, again, since not much known as biomarkers in children, we really wanted to kind of fill our data. And this is the results of this kind of digging into them. So boys are in blue, girls in red. For 2 biomarkers, isoprostane and CC16, the levels were lower in girls compared to boys. We did see some similar relationship of isoprostane in Shamarko's children. So again, this is also reported in some other previous studies. So as a result, we can summarize that most biomarkers of oxidative stress and inflammation were moderately correlated with each other. All showed variability over 2 weeks of collection. Differences by age and BMI were commonly observed, and boys tend to have higher levels than girls, at least for 2 of these biomarkers that we looked at. So the next question, important question for this study, was there anything in relationship of these biomarkers of response with biomarkers of exposure that Susan was presenting? So we looked at that, and red shows some of the significant correlations between WOX and PAHs. So let's look at isoprostane that had the most numbers of statistically significant relationship. We have only 6 on this table, but total was 11 measured, but the rest of them did not show any statistical relationship, statistically significant relationship. So we did not want to make this table even more crowded than it already is. So another interesting fact, isoprostane correlated with 5 out of 8 with measurable relationship. However, a desoxyguanidine had statistical correlation with yet another chemical, in this case, pyrene. And prostaglandin and CC16 also had, each of them had at least 3 correlations with 3 different, but different chemicals. So what it all means, this complex picture? In my mind, it means that different biomarkers, all of them actually showed some relationship with exposure, but they complement one another. So if we would be using only one biomarker, we probably will miss some of these relationships that we were able to demonstrate using this panel of 4 biomarkers. So this is a summary of it that I just mentioned. So they provide complementary insights into biological response to air pollution exposure, and in this way they are helpful for us in biomonitoring study. So this is the first study, to our knowledge, to establish a relationship between walks and pHs with oxidative stress and inflammation in children living in a community heavily impacted by air pollution. So a panel of these 4 biomarkers presents a comprehensive picture of the relationship with air pollution, as they show correlations with different urine metabolites of walks and pHs. And the good news, biomarkers of oxidative stress and inflammation, as well as urinary biomarkers of exposure, may be useful tools in biomonitoring pollution in children. And this is my lab. I always like to acknowledge people who actually do the job, my lab manager at Holland, and doctoral students and some of my undergraduate students who also contributed to these many experiments that they actually have to do to analyze this data. Okay, thank you. Oh. I think I'm loud enough to hear it. Hopefully it was possible to hear this.
We have some time now for questions, both from the panel and from the audience, including online. Go ahead, Jenny.
Hi, thank you for that presentation. I'm always wondering how to correct children's biomonitoring for age or size. I know that for NNAL in urine, which is a metabolite of the tobacco-specific nitrosamine NNK, it very much is much higher in younger children exposed to the same air pollution from tobacco smoke as older children in the same environment. So I'm always wondering how you can correct for the age effect. And I'm wondering if you looked at actually not just BMI, but actual weight, like how big they were just in pounds, as an effect or some way. I was just wondering how to correct when you have children of multiple ages in a study, just something I've thought about and struggled with.
Obviously, when we have a larger study, the typical approach that we're using is this models that would incorporate age and in some cases BMI and sex, depending on what is statistically appropriate. But it's not going to be simple regression or correlation relationship that we report here. We did compare by age and by sex some of these biomarker analysis, but when it goes to comparing these exposures, like we have here, we have actual data for each individual urine sample that we were able to compare. Here we did not do like mixed model with repeat measurements because we just didn't have enough data, but should we have larger number of subject and repeat, this is how I would approach it.
I guess someone who had a very big for their age kid as well as a small for their age, I always wonder if it's only age or if we should be incorporating, size as well, that kind of thing. So,
well, BMI is reflective of size, obviously, because we can account for age, but you're absolutely right, Jenny. Children are all different. And this is why to do this more generalized conclusions, we do have larger numbers. So this variability between children would not hide important relationship with, let's say, this air pollution exposure. So I really like idea of repeated measurements in the same children. Here we just look like they're independent. It's not quite correct way to do it, but I think that I already mentioned when we do, and we actually plan to do very similar analysis of biomarkers in biosphere study that was mentioned earlier, that already have 64 pairs of parents and children. So I'm looking forward to get the samples in our hands so we can look at the biomarkers in this larger study. So between these two, we will be pushing some more impressive number of observations and potentially more informative analysis of relationship with exposure.
Just following along those lines, so just a couple of comments more so than questions. It's amazing to see when you have one of those slides where you're showing us the change of BMI over age, which there are very substantial increases. I would suggest going through maybe showing BMI for age z-scores or percentiles, because normally BMI does go up in adolescence, right? So BMI, in this case, let me take a look here. So like a BMI of 15 for, you have children of 5 to 13 years old, right?
Yeah, this is definitely something that we've done in our previous published study. And we can do it here as well, but given limitations, I thought let's do it simple way before we go into more complicated way that would give us more precise assessment. And this score obviously will be one step to go towards this goal.
Right. I mean, this is just a minor thing, right? But still, nonetheless, I mean, I'm looking at a BMI of 30 for a 13-year-old. That is a very high z-score we're talking about, or maybe a percentile of 96, 97. I have to take a look at that. But anyways, these are just smaller things, but kind of getting to your underlying question about what are the normal concentrations for a lot of these biomarkers in children, and a lot of it hasn't been studied. For example, within our study in Espina, it's pesticides and child development. In adolescents, we're seeing that younger adolescents actually have much higher inflammation markers than older adolescents. So we initially started scratching our heads, what's going on? Why are CRP, VCAM, ICAM, pretty much everything that we measured were substantially higher in younger adolescents than older adolescents. And so this, for a lot of this stuff, this isn't described. So I'm guessing that for a lot of the markers here that you have for oxidative stress and whatnot, I don't know, but I don't think they're probably standard or normalized cutoffs of what those values are for children. But at least some of the things that we were scratching our heads with finding with our own studies is that maybe it's because the rate of growth is so much higher in younger ages, and that's actually causing some inflammation. But we're still kind of scratching the surface of that. I don't know if you have any thoughts.
Two thoughts. Because we've done a lot of studies in Latinas, in Mexican American Latinas. Chamacas cohort is a very big cohort that we followed for the last 20 years, from birth to now they're 20 years old. So we have quite a few data, for instance, on isoprostane, not so much on other biomarkers, but isoprostane, we look this way and that way. And another aspect of that cohort, high prevalence of obesity. Children with age, their rate of obesity and overweight was progressively increasing, starting at 5, and on it goes. But obesity is has a strong relationship with oxidative stress, because it is known in adults. It's one of the mechanisms of adverse health outcomes with obesity. It's an oxidative stress. They're just body is overloaded with free radicals that they cannot cope with. So one of the things that for me is particularly interesting, should we have a little more data, how obesity in children and air pollution exposure, especially in the places such as Central Valley, such as Fresno, such as Stockton, where both are very high, how they interact with one another. Never mind socioeconomic status, that may be another well-known predictor of increased oxidative stress, not only in children, but in adults. So it's a complex picture. So when we just pull one thing out, we see, like this elephant, we touch, trunk, and we know one part of the story about elephants. But our goal is to continue doing this study, to bring a picture together as much as possible. But it's difficult to collect these samples. It's absolutely important to have sufficient sample sizes. Nothing we can do about it.
Thank you so much for that presentation. I just want to distinguish, because we had a question period and we now have a longer discussion time, but I need to call for public comment. So I just want to check in with Rebecca if there's anybody online. Nothing public comment. So we can just sort of go ahead and go on into our discussion section. We have.
Can I be excused, or you want to discuss this in yourself?
Do you have a question? We have one more question for
Of
you,
course. Absolutely, Maja. Mhm.
and then you can be excused.
I was just also wondering about the role of physical activity as they age, 'cause especially for air pollution. If you run around a playground, you're getting like 3 times as more as a kid than if you're sitting down. So I'm just, it'd be nice to have activity level to put on top of that for this particular exposure.
Absolutely, wonderful, wonderful suggestion, because we actually done study of, but it was done not on children, it was done on students, primarily in chamber, John Barnes and Dr. Germany, some of you know, professor at UCSF, done study in the chamber. We looked at the response to exposure to ozone at the 3 different levels, just filtered air, 100 and 200, and they were doing exercises on the bike periodically. So we were able, with repeated measurements, collecting samples, and not just urine, but also blood samples from this controlled experiment. So we actually were able to see, and it's known from other, we published this paper, that it is known that subjects, adults, no children data, that definitely have relationship with oxidative stress markers after they have exercise, especially intensive exercise, or like climbing mountains, when they also have like changes in oxidative exposures. So with, I hear what you're suggesting, Jenny, that we have to take into account this particular possible contributors. And don't forget diet, because we also really would like to know diet, especially when children are obese. There is very intricate interconnection, exercise, and air pollution exposure, but what other exposures they may have. So the more the merrier. So, you know, if you have sufficient funding, we can do stuff like that. So I hope you will advise, you know, the subjects, you know, people who make decisions, that this is what we need. Okay, I think I have.
Thank you very much.
Thank you
Appreciate
very
it.
much. Well, this is-
So we can continue our discussion through just about 3:30, a little bit after. So we have open discussion now, and I will pass along some questions that are potentially to stimulate discussion that come from the program. So a couple of topics include: what databases should the program consider to help identify potential environmental sources of naphthalene or carbaryl in the Stockton area? They've already started exploring groundwater ambient monitoring and assessment, the GAMMA program data, and the pesticide use reporting data. So any sources of information aside from those 2 sources that might help understand the exposures that they were seeing? Another question: it will be challenging to explain some of the key concepts and limitations of the study to participants and to the community members. Do you have any recommendations on how to communicate study limitations, such as half-lives and specificity of biomarkers, statistical significance and small sample size, and any other guidance on key concepts that will be important to convey to the community and study participants? So those are some questions from the program to inform the discussion now, although I think any input that you want to provide to the program is welcome. Do you have a slide with them? Yeah, go ahead, Jen.
This is a quick clarifying question about the air levels of naphthalene, because we didn't see a lot about the air levels of naphthalene outside and how they compare. Were they high? I know you said the one week was higher than the other, but I didn't really hear how high they were kind of objectively.
Yeah, that's a good question, because we spent a lot of time looking for data to compare it to. PAHs aren't routinely monitored in many places. But let's see, what we can say is I did find a review article that published all of the, or as much as they could find on what typical outdoor air levels are like. And our levels were right in the meat of what you would expect to see in an urban location. We did also compare them to, so Betsy Knopf, who's at UC Berkeley, and actually ran the PAH analyses for us. She's done it in other studies. And so we compared our levels to some of those levels, and they were, hot. Like she did some monitoring in Richmond during the campfire, when anyone who was around here remembers it was super smoky. And our levels were about on par with that. So that's kind of high. But then comparing to some levels of other studies that she's done in Fresno, there's just a lot of variability, because, well, I'm talking mostly about naphthalene, because this is what we were really kind of drilling down on. It disperses really quickly, so there's huge variability. So some of our levels were kind of on par with what you saw in Fresno in the winter, but in some cases it was quite a bit lower than what she saw in Fresno. So I know that's not a great answer, but the other thing I can say is that the levels indoors and outdoors were pretty similar. I think they were a little higher indoors during the first week, but they're close. And the levels were much lower than the US EPA's, chronic reference value for what that's worth. It was an order of magnitude. Our maximum level was lower than that. So does that answer your question?
Yes, it does. I was just thinking, I was kind of wondering, it's really worth trying to get some more urine values, even anonymous, just make sure that you found that again before you worried the parents or the school, or even to make sure that school isn't full of mothballs, or I don't know. I mean, just to see if that's kind of a more generalized finding.
Well, we will have the results from Biosphere, although I'm not sure when we will have them, not before we go to the community. So that is something definitely that we're grappling with, is how to communicate this with, we don't want to cause unnecessary alarm. But all of the participants have already gotten their individual results returned, where it is compared to NHANES in those packets, but how carefully people actually read those packets and understand them, we're not entirely sure. But yeah, so that's kind of why we put some of these questions out here. You'll all have suggestions about how to share these findings with the community.
I think, sorry, I just think that, the community can handle more uncertainties. People have shown them, people think, and saying, we don't know what this is. We're really wondering if this is a marker for your kind of air pollution in the valley, and we're following up on that might be the way to phrase it, because that is the truth, right?
Yep.
Another question. Just another question. Maybe you mentioned this, but did you notice any difference in the concentrations of the naphthol in depending on which of the rooms they were in? Because you talked about the construction being so different of those, so.
We didn't see any obvious pattern by class. I mean, it was, so high levels were seen in almost all the kids, so it was sort of across classrooms. We also found it in the morning urine and also in the afternoon urine. Like there was really no, I mean, small samples, so it's hard to really know what's going on. But we did do a lot of, hunting and pecking and really trying to see if there was something that was driving it. And so far, no luck.
Susan, I think Dan wanted to weigh in. Yes.
Oh, okay.
Go ahead, Dan.
Hi, Dan Sultana with Biomonitoring California, OEHA. I just want to make a quick comment. I think Susan touched on it, that we saw high levels of, the 2-naphthol in AM samples. So those were, kids coming in on Monday with the urine sample. So that wasn't necessarily due to exposure at school. That was my comment. Thank you.
Oh, I think Dan was just noting that we did see a lot of high levels, or just as many relatively, in the morning urine, the first on Monday morning. So those kids have not been at school all weekend. So it doesn't seem like the exposure is necessarily tied to the school. And then we did actually, we have the residential addresses. We did geocode them. There was no sort of obvious pattern. It wasn't like they were all from one neighborhood. So yeah, it's a mystery.
Go ahead. I have a question after. Is this connected to?
Yeah.
Yeah. Why don't you go first and then Jose? And then I'll go.
So I found it interesting that you found an association of the naphthalene levels with having an attached garage, and also with consuming the foods that were barbecued or grilled, or and so I'm not familiar with any other studies that have reported that naphthalene levels or biomarkers are associated with consuming those types of foods. I wondered if anyone on the panel had heard that before.
I mean, consumption of grilled and barbecued foods definitely is associated with increased metabolites of various PAHs. I mean, that is a major source, but yeah, those specifically being elevated and the other ones not. I mean, that's kind of what's puzzling about this to me, for sure.
Jose, do you have
Can you remind me, you measured also 1 naphthol, or is it only 2 naphthol?
Well, no, we measured 2 naphthol.
Okay.
But the lab's method wasn't able to separate out completely 1 naphthol. So that's what the idea of our follow-up lab analyses is that we're doing now. They're going back on, we have some leftover extracts, not from every participant, but they're going back and using a different method where they'll be able to separate out the 1 naphthol from 2 naphthol. And so that's going to be really critical in interpreting our initial results. And so we're eager to get those, and we'll hopefully get them soon.
Right. Yeah, because that will help you if you're thinking about carbaryl. Yeah, that's really only a 2 naphthol, and you don't see that with the 1 naphthol.
Other way around.
Is it the other way around?
Yeah.
No. Okay. Either way.
Yeah.
It will help you discern if it is at least coming from the agricultural side, which is what you're trying to get at around ultimately, right?
Right.
Well, I guess we'll have to wait for for that to start.
We were hopeful we might have it by today, but you know how the UCSF lab actually had to move labs at the end of the summer, so that really disrupted their timeline on everything.
I had a question that was a little bit bigger picture about, we're talking about naphthol because the measurement of the metabolite, was nearly 4 times what was in NHANES, as you presented early on. But when you presented those results, also, you said that there was nearly ubiquitous exposure to a long list of VOCs and PAHs. And I didn't follow whether that was ubiquitous in this sample and in NHANES. Like, are we mainly focusing on naphthol because that was the only significant difference between this sample and NHANES?
Yes, well, so my comment, the nearly ubiquitous exposure is just based on detection frequencies. And in this sample, and the detection frequencies were pretty similar to what you also see in NHANES. And so what was really striking in comparing our differences to NHANES was the two naphtol levels.
So that was the only thing that stood out as different from NHANES.
Well, actually, the other thing that stood out was our 1-hydroxypyrene levels were lower than NHANES. But that one is more difficult to interpret because our level of detection was quite different. And we actually had a lower level of detection for ours. So we can't, we don't know if that's why our levels were lower.
And when you did results return, obviously you reported everything that you had measured for participants and put it in the context of the NHANES data.
Yep.
So you've already provided the guidance to participants on their other VOC and PAH exposures.
Yes.
And that's why the key questions are just around this difference. Is that right?
Yeah, I mean, we anticipated that we might get some phone calls from the participants after they got their packets, but we didn't. But we are going to be holding community meetings where we're going to be presenting the summary of the findings. And I think, that's when it'll become they'll take notice. So, we want to be very careful about how we present that and what it might mean.
Yeah, go ahead.
I was just wondering if there might be other opportunities, maybe not in a formal way, maybe at these community meetings more informally, to ask about other potential like household sources like mothballs. I think these toilet bowl thing deodorizers have naphthalene in them. Especially since it seems like maybe it's not a school-based exposure or an outdoor one.
Yeah. So
are there any household pesticides that are available, consumer pesticides that people could also be using at home?
There could be. So for carbaryl, restrictions were placed on its sale in California in 2019, I think. But that doesn't mean there could still be stockpiles on the shelf, stockpiles in their garage. Also, you can get whatever you want on Amazon. It doesn't matter what you're allowed to sell in California. So for carbaryl, yeah. So so that's for pesticides. And then for naphthalene, we have been kind of poking around looking for consumer products so naphthalene was removed from mothballs, or it's not allowed to be sold in California, mothballs with naphthalene. But again, we did a quick search, and actually naphthalene is, it's very easy to get from Walmart or, Amazon. And actually there's a lot of off-label uses that seem like possibly are going on. So, we found where it was a YouTube video where, someone's grandma was recommending you mix naphthalene balls with fabric softener and you spray it on your floors to deodorize them or use it as pesticide. So who knows? But, we, in preparation for planning for these community meetings, we are going to be reaching out to our community partners and talking about, potential next steps. It's such a small study, and I think our IRB would allow us, although I'd have to go back and look, to do some kind of follow-up questions, because there may be some very simple explanation related to a consumer product. But, we don't know because we only asked, the minimal number of questions on the questionnaire.
I can go back and find our actual data, but I was just pulling up a quick figure from the analysis that we did and published in ES&T, looking at VOCs in consumer product categories from the CARB survey, and found naphthalene in, looks like 12 different categories of consumer products. So we have those all laid out, and I'll give them to you. I just don't have them off the tip of my
That would be great.
tongue.
Were those like personal care products, any of those?
It's, I can look into it and see what they were. We have the product categories. We don't have the products because CARB groups them into product categories. And there's a whole range from, you know, things that are primarily used occupationally to consumer, to like personal care, things like that.
Yeah, which kind of brings me to and the reason why I go down the line of personal care products is that adolescent women tend to use a lot more products than adolescent men. And I wonder if you saw any gender differences for.
We did actually, but not in the direction that you would suspect. We actually found higher levels in boys than girls. I didn't actually mention that because we also turned out that the boys were more likely to live in houses with attached garages. So we really couldn't separate that. And then also in NHANES, you don't see a difference. Oh, and in NHANES, you don't see a difference, a gender difference for, at least for naphthalene or 2-naphthol. And Melton just handed me a summary of that paper that you were just talking about. And it looks like, well, there's a lot of numbers here. So this card was old mothballs, general purpose cleaners was one of them, paint thinners, caulking and sealant. There's a lot of construction, you know, sort of housing, construction stuff, adhesives, solvents. So yeah, these look like they're mostly building materials and yeah.
But something
But,
to point out, they looked at all system manufacturers gave like almost 5,000 for the general purpose cleaner, and only one had naphthalene in it. For mothballs, they have data for 28 different brands, let's say, only one had naphthalene. So they looked at 300 different products, paints, almost 300, only 2 had naphthalene in it. This is the data from CARB between 2014 and 15.
That is the difficulty with looking at the publicly available CARB data, is because it's by product category. If there's even one product within that category that includes naphthalene, then it's just in the product category and you don't know which product it's in. Thank you for mentioning that. Yeah, Jose.
So I think hopefully we'll get to see some of the results for the NAFTA 1 versus 2.
We will share.
For the next one to see
Yeah.
if really there's some agriculture. I mean, that would be one of the more intuitive ones, right? It is a very agricultural area. They're probably spraying by airplane over there. Might be worthwhile looking into a little bit, since you're looking already at that pesticide use
Yes.
reporting.
I mean, the thing is, this was done in December, so I don't know that there would be a lot of applications for carbaryl in December in that area, but you know, we can find out certainly.
And a lot of times with agriculture is whenever there's a rainy period, there's more pesticide use. Typically 1 to 2 weeks after the rain, they start using it, especially if it's been raining for more than 3 to 4 days, then you start spraying more pesticides too. So that's a way about also some of the weather data influencing the pesticide use, and then it's translating into exposure to nearby populations or something. But yeah, I mean, it sounds like you're getting into there, right? You're already looking at the associations with the attached garage. Okay, sure.
Yeah.
Yeah.
Hi, Jenny Quintana. I'm just looking at your questions up there, like what key concepts to say to participants. And if I understand, your PM 2.5 went down after filtration, this portable air filtration, your black carbon went down. Those are very important things. It worked. Putting the air filtration worked. And I think that would be a major message.
When they use the air filters, did you know what setting? I mean, most air filters have multiple settings and people won't use the one that really works because it's too noisy, especially in a classroom. So they may crank it down to the lowest setting. Is there a way of knowing whether they were, did you ask them to like,
Well, so when we initially set them up the first week, we set them, I think it was at a level 5, which was fairly high. And asked them not to touch them. But there were some complaints about the noise. And the second week, I think we turned them down to like a level 3. I don't remember what that corresponds to, the filtration rate, but we do have information on the settings, and they were.
so in terms of the advice to the community, that's like, if you're going to use them, it's important to use them correctly, but again, that's a difficult thing. But I think, what brand was this? The same ones?
It's the IQ Air Health Pro Plus.
Oh, okay. Because I don't know if that's a real quiet. I mean, some of these, like we have Austin Air, and at the highest setting, it's noisy. I mean, it puts out 300 or whatever, lots of cubic feet, and it can clean up the air, but it's really annoying. And I don't know if the Coway or Lavoie or some of these are quieter units.
Yeah, well, I mean, these are really designed for institutional settings. So, classrooms and other big rooms. So they're not super quiet. Although some of the teachers said, well, it's not like our classrooms are that quiet anyways. Compared to all the other stuff going on in the classroom. But.
We have probably time for another comment or question before we move on. Yeah, go ahead.
This is Laura. On your first question, maybe it's worth looking at the TRI emissions. I know it's a TRI listed chemical. I have no idea. Naphthalene, sorry, going back to naphthalene.
Yeah, I don't know. I haven't, I remember years ago, the TRI data sort of became worthless for a while.
Oh, really?
And then I don't know if it's been resurrected.
Okay.
But
yeah, I don't know how useful.
I remember like it was in the late 90s or something where like they lost funding or something. I don't know, but we haven't looked at TRI yet. We should go back and look at it. Yeah.
Oh, Laura, tangential one, once again, not super on utility side, would be the CARBS facility search tool, part of the CEDARS database that looks at air as well.
I was going to say CARB, and then the National Air Toxics Assessment from EPA has pretty high resolution emissions inventories and really release data that's required, for their assessment of residual risk assessments. They have to go in. I think they go down in many places down to even census track.
Yeah, I think I think we downloaded a bunch of that data, but we haven't looked at it yet.
And the EPA does both roadway emissions and point emissions and put them together in the image.
Yes, is there an online comment?
One quick question from Jeanlin, if you looked at 2NAP and dye and if that could contribute to exposures? Makes sense.
Yes, that's a question. Thank you.
I do know, well, maybe I should let Melton take this question. I wouldn't think so, but.
So we looked into the azo dyes because they are, some of them like Sudan 1 is metabolized to 1-amino 2-naphthol. And we thought that it may be possible that we are getting perhaps an additive from some snacks they use, but it didn't go anywhere, honestly, because it is not exactly 2-naphthol. It is 1-amino 2-naphthol. I don't know if it affects the lab results or not. We know that some other dyes go to this, gives this metabolite, similar, but not exactly the same one.
Thank you. Thank you. And related question, also 2-naphthalene, 2-naphthol could come from herbicide, laproanilide, according my limited research. Does that means 2-naphthol is a very specific indicator for the pH metabolite? Any comments?
Yeah, can you repeat that? I'm not sure I followed your question.
So when you present, you compared one lab and the 2 lab. And I believe you said that one lab might have 2 sources. One is direct exposed to pH. Second one is from Cabello. And then literature also said the same thing regarding 2 lab. One is come from pH, one is come from herbicide, laproanilide. But I don't know the scales and how volume produced. Does it raise this one for you to examine that the hypothesis 1-naphthalol is from 2 different sources, but 2-naphthalene, so naphthol is only from 1 source. At least literature to indicate it could come from a second source. Is a herbicide. Any comment?
Well, I have not seen any data that suggests that 2-naphthol can come from a herbicide. I do know that it's used in making some herbicides and pesticides as a industrial chemicals in manufacturing. And from what I understand, there's not a lot of data out there that suggests that that those exposures outside of an occupational setting are really important to the population. Now, it could be that if you're living right next to a site where that kind of manufacturing is going on, it could play a role, and that is part of the reason why we're looking to see what's going on in Stockton, and if there could be some other sources besides just naphthalene, if it could be direct exposures to 2-naphthol.
Thank you very much. That's a piece of information for you to consider. Thank you very much.
Okay.
One more online comment. Yes, this is from James Nakashima at OEHA. More of a statement, but carbaryl is an insecticide and insect activity would be low in December. And typically insecticides would be applied to protect the crop. If this was late in the year, the crop may have been harvested.
Thank you.
Okay.
That's a useful information. Thank you.
Thanks very much for the contributions. I know we have 2 panelists who have a tight plane connection, so they are going to go maybe before our last bit. Yeah. And I am going to reintroduce our next presenter, who is Stephanie Jarmul, the section chief of the Safer Alternatives Assessment and Biomonitoring section at OEHA. She'll provide a brief overview of the plan for SGP meetings in 2024.
Well, I'll keep this quick. Hello again. I'm just going to briefly discuss our plans for next year's scientific guidance panel meetings. So at this point, we're planning to hold 3 meetings in 2024, and you'll see we've worked with the panel to select the following dates. We have Wednesday, March 20th, 1 to 4 p.m., Friday, July 19th, 10 a.m. to 4 p.m., and then Thursday, November 7th, 1 p.m. to 4 p.m. You'll notice that our meeting in July is planned for a full day, so we can delve further into a few program items. And we will make a determination on meeting location and format, so whether it will be in person, virtual, or hybrid, depending on any changes to the requirements of the Bagley-Keene Open Meetings Act. So hopefully we'll have more information on that early next year. Similar to this year, our standing agenda will include a program update, as well as more detailed project updates, such as updates on our community biomonitoring and surveillance studies. As always, we will have time for discussion and input from the panel and the audience. There are other potential topics of interest we have planned or could consider exploring. These include the consideration of chemicals for the designated and priority lists, such as the expansion of the PFAS chemical group on Biomonitoring California's priority list. We are also hoping to invite speakers and have a discussion with the panel on biomonitoring for biomonitoring health-based guidance values later next year. And we could also consider hearing from experts in the field on the challenges and opportunities for biomonitoring for oil and gas exposures that as I mentioned previously. And of course, we welcome any input from the panel and audience on these items and additional topics we should consider. So I'll stop there and see if anyone has any questions or suggestions about this plan from the panel or the audience.
Great. Yeah, we have 10 minutes now for input to the program, either from the panel or the audience or online attendees.
Hi, Lara. I guess I'll just second my support or add my support to the idea of trying to do something with AB 496 and what opportunities that might provide to evaluate that policy. It sounded like that was a safer cosmetics one. Maybe I got the number wrong. But it sounded like maybe there's not good baseline studies available, but if you feel that there might be more exploration that we could do around that, I think that would be would really leverage the power of biomonitoring. So maybe that could be a topic.
Great, thank you. Any other suggestions or feelings of excitement?
I was
Anything
glad
from
to
the-
hear
yeah.
about the oil and gas exposure biomonitoring discussion. You know, it's not something I personally know a lot about, but I feel like it's one of the areas that communities are particularly very interested in knowing. Anybody who lives near, and there's so many people who do live near oil and gas extraction sites, and it's big in California, and certainly there is evidence connecting it to health outcomes, especially birth outcomes. So I think that's interesting and glad that you're thinking about it.
Great, and yeah, we have a couple of people who might be interested in presenting to the panel, so more to come next year.
Is there anything from remote attendees? In that case, we could, I will then introduce the open public comment period, which is our final step of the afternoon. So we have 10 minutes allotted for open public comment, and commenters can provide input on any topic related to biomonitoring in California, not necessarily to the agenda of today's meeting. I'll read the instructions again, just so everybody has them. Webinar attendees can submit written comments and questions via the Q&A function of Zoom webinar or by email to biomonitoring@oeha.ca.gov, and we will read them aloud. If you wish to speak, please alert us by using the raise hand feature in Zoom webinar, and we'll call on you. And if you're in person and wish to comment, please come to the front or raise your hand. So open public comment period here for anything related to the program, not necessarily just the contents of this meeting. And we'll just wait a moment to see if something comes in online. Nothing coming in online. Okay. In that case, I just want to announce that there will be a transcript of this meeting posted on the Biomonitoring California website when it's available. And the next SGP meeting will take place in March, on March 20th from 1 to 4 p.m. And there will be, as Stephanie said, information about options for attending that meeting closer to the meeting date. Again, I want to thank program staff and presenters for today, also the panel and the audience, and adjourn the meeting. Thank you.